Good day, everyone. Our group will be reporting about Dr. Carmelita Divinagracia and her theory of composure behavior. Dr. Divinagracia is one of the most respected Filipino nurse theories, and her theory focuses on maintaining emotional stability and holistic care for patients. Through her work, she highlighted how a nurse's composure and empathy play a big role in the healing process. Dr. Carmelita A. Divinagracia is a Filipino nurse, educator, and researcher who made a significant contribution to the field of nursing. Through her composure behavior theory, she also served as the Dean of the University of Santo Tomas College of Nursing, where she inspired many future nurses. Her work centers on holistic patient care, meaning she emphasized not just physical treatment but also the emotional and psychological well being of patients. Dr. Divina Gracia's strong educational background shaped her as a leader and theorist in nursing. She earned her bachelor's degree in nursing from the University of Santo Tomas, where she later completed her master's in clinical nursing and doctorate in nursing education. Her continuous pursuit of learning reflects her belief that nursing is both a science and a calling, one that requires not only knowledge but also a compassion and understanding.
In these slides, we will explain the acronym of composure, which represents the essential caring behaviors and attitudes that nurses should practice to help patients achieve peace, trust, and healing both physically and emotionally. Competence. This means having the right knowledge, skills, and confidence to perform nursing duties effectively. A competent nurse provides safe, accurate, and professional care which help patients feel secure and trust the nurse's abilities. O for orderliness. Orderliness refers to being organized and maintaining a clean, calm, and structured environment. A neat and systematic approach to care helps prevent mistakes and reduces patient anxiety, making them feel that they are in good hands. M for mutual supports. This emphasizes the teamwork, cooperation, and emotional support among nurses, patients, and families. When nurses show mutual supports, patients feel cared for not just physically but also emotionally, knowing they're not alone in their journey. P for presence and prayer. Being present means genuinely being there for the patient, listening, comforting, and showing compassion. Prayer adds a spiritual dimension to care, offering comfort and hope, especially to patients who draw strength from faith. O for open-mindedness. An open-minded nurse respects differences in belief, values, and backgrounds. This quality helps nurses deliver non-judgmental and culturally sensitive care, allowing patients to feel accepted and understood. Stimulation. This involves encouraging the patient's minds and emotion through conversation, motivation, and positive reinforcement. Stimulation keeps patient mentally active and emotionally engaged, which can promote faster recovery and prevent feeling of isolation. U for understanding. Understanding means showing patients compassion toward what the patient is going through. It involves empathizing with their pain, fears, and emotion, making them feel valued and respected as individuals. R for respect. Respect is treating every patient with dignity regardless of their background or conditions. It means honoring their privacy, autonomy, and choices, which foster trust and comfort in the nurse-patient relationship. E for empathy. Empathy is the ability to feel and share another person's emotion. An empathetic nurse connects with the patient on a deeper level, offering emotional comfort that promotes healing. The theory focus slide explains what the composure behavior theory emphasizes in nursing practice. It centers on emotional care, spiritual connection, and the inner strength of the patient. The first one is focuses on emotional care and inner strength of the patient. The theory goes beyond physical treatment. It recognizes that healing also involves emotional and spiritual well-being. Nurses help patients build inner strength, encouraging them to stay positive and hopeful despite illness. These emotional supports help patients manage anxiety, pain, and fear more effectively. Number 2. Nurses act as supportive companions who bring peace and confidence. In this theory, nurses are not just caregivers, they are companions and comforters. Their presence, calmness, and empathy bring a sense of peace and assurance to patients. When nurses show compassion and understanding, patients begin to feel safe, valued, and confident in their recovery. Third, promotes trust, comfort, and a spiritual connection in nursing care. The composure theory also highlights the importance of trust and faith in the nurse-patient relationship. By incorporating spiritual care such as prayer, listening, or simply being there, nurses help patients find comfort and inner peace. This creates a caring environment where healing becomes shared emotional and spiritual experience. The meta-paradigms in nursing are the four major concepts that define the scope and nature of nursing practice: person, environment, health, and nursing. In the composure behavior theory, each meta-paradigm is explained through the lens of holistic, compassionate, and spiritually guided care. Person, a holistic being, physical, emotional, social, and spiritual. In this theory, the person is viewed as a whole and interconnected being, not just someone with an illness. This means nurses must care for all aspects of a person: their body, feelings, relationship, and faith or belief. The nurse recognizes that every part of a person's life affects their health and healing. So caring for the person means promoting balance and harmony across all these dimensions. Environment. Setting where caring and composure behaviors promote healing. The environment refers to the everything around the patient that influences their well-being: the physical setting, emotional atmosphere, and even social or spiritual surroundings. In the composure theory, a healing environment is created through caring behaviors such as kindness, orderliness, calm, and empathy. When the nurse maintains a peaceful and supportive environment, it helps reduce stress, encourages relaxation, and supports recovery. Health, a state of inner peace and balance achieved through supportive care. Here, health is not just the absence of illness, it is a state of inner peace, balance, and wholeness. This kind of health is achieved when nurses provide emotional and spiritual support that helps the patient feel calm, hopeful, and cared for. The composure theory sees health as both physical well-being and emotional stability nurtured through compassion and understanding. Last is the nursing, providing compassionate, composed, and spiritually guided care. This means what nursing truly means under the composure framework. Nursing involves giving care that is compassionate and composed, showing calmness even in stressful situations. It also includes spiritual guidance, where nurses respect and support the patient's faith, values, and belief as a part of the healing process. A nurse's composed attitude brings comfort and reassurance, making care both professional and deeply human. The summary slide reinforces the main points of the composure behavior theory. It emphasizes that caring is therapeutic, helping patients heal emotionally and spiritually. The theory also promotes competence, empathy, and spirituality as essential qualities in nursing.
Good morning, Mrs. Paliso. How are you feeling today?
Oh, Nurse Vivian, my wrist is still hurt and sometimes I feel dizzy.
Let's take your blood pressure. It's a bit high today. Maybe you didn't rest well. Did you take your medicine?
I forgot after breakfast.
That's alright, but it's important to take your medicine at the same time every day. I'll help you make a simpler schedule.
I can help with that, nurse. I remind her before lunch every day.
That's wonderful, Jairus. When family works together. That's wonderful, Jairus. When family works together, recovery becomes faster. Mrs. Paliso, try to walk slowly around the house for a few minutes each morning. Gentle movement helps your knees and blood flow.
I'll try, nurse, but sometimes I just feel tired.
That's okay. What matters is you do what you can, step by step. Remember, health is not only about the body, it's also how about we feel inside.
Yes, lately she's been lonely because she can't go outside.
Then maybe you can invite her to join the barangay's morning exercise next week. I'll be there too. It's a fun way to meet others and stay healthy.
Really? I love that. Thank you for taking care of me, Nurse Leia.
Hi everyone, how are things going?
Much better, nurse. Mom walks every morning now. She even talks with our neighbors again.
Yes, I eat more vegetable now and my favorite is malunggay soup. That's great to hear. You are doing exactly what we talk about, living a healthy lifestyle.
You're right. Our neighbor, Mang Tonyo, wants to join the morning exercise too.
See, that's community health in action. One family inspires another. That's how we build a healthier barangay.
Nurse Leia's actions show what Carmelita Divinagracia's theory teaches, that nursing care must be holistic. It touches the body, mind, and spirit of individuals, families, and communities. It focuses on health promotion, disease prevention, and compassion.
Being a nurse means more than giving medicine. It means guiding, teaching, and caring for people in hospitals, homes, and communities. Thank you, Nurse Leia. Because of your care, I feel stronger and happier now.
And I learned that health starts with small steps and family teamwork.
Exactly, when we care for each other, we create a community that's healthy, happy, and full of hope.